Hello, everyone. This is Faye, and we're here once again to talk about Medicare changes for 2026. This webinar is being recorded. I'm Faye, and I sell Medicare plans. And I want you to know that I do not represent all plans in your area. I can ask that if you want to see all plans, please contact Medicare.gov, 1 800 Medicare, or call your local SHIP organization to get information about all plans. And if you've already received your 2026 Medicare New Handbook, the plans that are available to you are in the back of that book for your area as well. So first, let's start with what is Medicare. Medicare, of course, is a federal health insurance program. It's for people who are age 65 or older. It's also for younger individuals who have certain disabilities, people who have collected Social Security disability for 24 months, and for those who have end-stage renal disease or Lou Gehrig's disease. Those people may also qualify for Medicare. So there are actually two parts to original Medicare. You've heard of the red, white, and blue card, and it has two parts on it, Part A and Part B. Some people don't have both parts, but that's okay. There are two parts to original Medicare. Part A is, of course, hospital, and the hospital portion of Part A is one that you receive without any premium if you work and pay into the Medicare system for at least 40 quarters during your lifetime. Or your spouse may have worked and paid into the Medicare system for at least 40 quarters, and you could still qualify for the Part A without paying a premium. Part A helps you to cover inpatient hospital, skilled nursing, home health care, and hospice. Part B, of course, does have a premium, and that premium is to be paid by you, or if you qualify based on income and assets, it may be paid through what's called the Medicare Savings Program by your state Medicaid system. The Part B premium changes every year, and it is set by Medicare. It's not set by me. It's not set by an insurance company. It is set by Medicare. Medicare comes under the Center for Medicare and Medicaid Services, which is housed under the Health and Human Services Division of the federal government. Now, Part B will help you to pay for outside medical services that are covered. It might include surgeries, doctor's office visits, lab services, tests, x-rays, ambulance. All of those things come under durable medical equipment, could also be included in their Part B. Those are expenses that come under Part B of Medicare. So there are actually some options that you have, some choices that you can make when you're eligible for Medicare. And the first one is, of course, to use original Medicare as your primary insurance, your health insurance. So your red, white, and blue card, your original Medicare, Part A and Part B would be primary. Now with that, because Part A and Part B helps you to cover those expenses that I just told you about, you would need a Medicare supplement or a Medigap plan that's going to pick up expenses that are approved by Medicare but not paid by Medicare. A good example of that would be in Part A, if you're an inpatient hospital, you have an inpatient hospital deductible that you would be paying out of your pocket unless you had a Medicare supplement that you're paying a monthly premium to an insurance company, and that supplement picks up that Part A deductible. Another example of using the supplement would be for Part B expenses. There is an annual Part B deductible for 2025 that's $256. That changes for 2026. However, that you're going to pay out of pocket, but all of the other expenses after that annual deductible for Part B covered expenses, when Medicare approves the service, pays 80%, then the 20% would either be out of your pocket or it would be covered by the Medicare supplement. Remember, the supplement you buy from a private insurer. All of the supplements have the same benefits. So supplements are known by alphabets. A Plan G, a Plan N in Nebraska, Florida, Idaho, California, wherever, it's the same benefit. The same Plan G, Plan N from any of the insurance carriers are going to be the same benefits. The difference will be based on where you live, because the rates are determined by geographical area, age of the person who is applying for the supplement, gender of the person who is applying, and if you are a tobacco user or not. Now, when you become first eligible for Medicare, you have what's called guaranteed issue, which means at that point, within that 6-month period, you can get a Medicare supplement from any of those companies that are approved to offer the Medicare supplements or Medigap plans in your area. You can get it without them doing underwriting or asking any health questions. After that period, then you will need to answer health questions, and during that time, you may or may not be accepted. With original Medicare and then the supplement, which premiums can range from $130 a month to $300 a month, depending on those criteria for creating the rate, you would also need a prescription drug plan. So you got 3 cards, 3 plans, but you have a full comprehensive program. You have original Medicare, and then what original Medicare approves but doesn't pay, except for the annual Part B deductible, the Medicare supplement or Medigap, if it's a G or an N, will pick up. And those two have some slight differences, but you can talk to me about what those differences are. Then you would have your prescription drug plan that would actually be used for covered prescription drugs. That's another plan that you're buying from an insurance company. Insurance carriers are submitting their prescription drug plans to Medicare. Medicare approves them so that they can offer them. And the plan will have a premium that you're going to pay monthly, which could be $0 or $4 a month to as much as $130 a month, depending on which prescription drug plan is going to work for you. And you're looking for a prescription drug plan that can cover the prescriptions that you're taking. So that will differ based on what prescriptions you're taking. Age is not a barrier. You do need to have Medicare Part A or Medicare Part B, or you have both. And once you get A or B, you are then eligible for the prescription drug plan. And at that point, you should get the prescription drug plan. Don't wait to get it, because if you don't get it when you're first eligible, you will need to wait for certain open enrollment periods, annual enrollment period to get a prescription drug plan. And then you may have a penalty for not having the prescription drug plan. So the first option includes three pieces: original Medicare, that's your red, white, and blue card with Part A and Part B, the Medicare supplement that picks up what is approved by the original Medicare but not paid except for the annual deductible, and then the prescription drug plan. And the prescription drug plan will have a monthly premium that you'll pay to the insurance company. The prescription drug plan will also may have a deductible, coinsurance, and copays. So paying the monthly premium for the prescription drug plan doesn't mean that your prescriptions are going to be zero. One way. A second option, and these are the two most common options. There are some other options because you might have an employer plan or a union plan, but these are the two most common options that people are going to face. So the second option is Part C, which is also known as the Medicare Advantage plan. And there are discussions, there's controversy, there's talks about Medicare Advantage plans, but the Medicare Advantage plan gives you those benefits that are inclusive of what's in original Part A and Part B of Medicare. So all of the benefits that are covered in original Part A and original Part B of Medicare are included in the Medicare Advantage plans, as well as most Medicare Advantage plans have no premium. And I know that question is going to come up. This question is in your head right now. You're wondering, how is it that the Medicare Advantage plan can have no premium? And you just told me that the Medicare supplement can be as much as $300 and the prescription drug standalone can be as much as $130. That together with my Part B premium, I'm over $500 a month in one way. But I could have something that has no monthly premium. Yes, you can. How is that? It's because the insurance company that you choose to get your Medicare Advantage plan from is being paid from the Medicare fund, because original Medicare is not going to pay your bills. The insurance company is responsible for paying those bills for expenses that are covered. So every month, whether you go to the doctor or not, whether you have an x-ray, whether you get a prescription or not, the insurance company gets paid from the Medicare fund. That's why you have no premium. Pretty simple, huh? So now with the Medicare Advantage plan, you've got the benefits of original Part A, original Part B, and most will include the Part D prescription drug plan. Now, there are two types that are basically generally known, and that's the HMO, Health Maintenance Organization, or PPO, Preferred Provider Organization. The difference being the HMO will offer you more benefit because all of your services, all of the covered services, must be within network unless it is an emergency. So if they're all in network, the insurance company is already contracted with the people that are in the network, that they know what the cost for your services are going to be. The PPO gives you the option of going in network or out of network. That will have a higher cost share for you because you now can make the decision at the time of the delivery of the benefit whether you want to be in network or out of network. And since you have that choice, you're going to pay more out of pocket for the PPO benefits that you enjoy versus the HMO benefits. Some people like choice, and that's great. The PPO plan gives you more choice, but you have higher out-of-pocket cost. Are there any questions so far about the options that I just explained? In summary, the one option is 3 plans, 3 cards, original Medicare, a supplement, and a Part D plan. including the Part B premium, that could total about $500 a month every month. And then you have the Medicare Advantage plan, which has all of those benefits, and you do not need a supplement. If anyone tries to offer a supplement with the Medicare Advantage plan, it is illegal to have a supplement with a Medicare Advantage plan. So you have the benefits in your Medicare Advantage plan of Part A, Part B, and Part D all rolled into one plan. Now, it doesn't mean that you're not going to have an out of pocket just because you don't have a monthly premium. You will have a cap on the amount that you can spend for covered medical expenses. Within each plan has a different amount. You also have a cap that's universal for prescription drugs of how much you will spend for deductibles, copays, or coinsurance for prescriptions for the year. So there are some maximums in there that will help you to actually see if this is going to work for you. So let's talk about the Medicare Advantage plan, Part C, and is this a benefit that's going to work for you? Think about it. Let's think about it. It is an option, and you're only paying within the plan the copays or coinsurance for those things that you're actually using. So you're not paying a monthly premium, but there may be services within the plan that you will have copays or coinsurance. Now, why should you review Medicare benefits annually? You will want to know what the changes are in what you have now. You want to know what you're going into. You do not want to go into your plan next year blindly without knowing what your costs might be, how the network changes might affect you, if there's any other changes that might affect you. Things are happening so fast this year for annual enrollment. Of the 23 years that I've been in this business, I've seen things happen like overnight that have never happened before. So you really want to know what's going on with your plan. The first way that you find that out is through your annual notice of change, which I'm going to refer to as ANOC. The ANOC is something, if you have a Medicare Advantage plan, every insurance company sends that out to you at the end of September every year. Now, even though we can't talk about what's going to happen for the next year until October 1st, you get this in September. You know what your current year benefits are, and the ones that are changing are in that annual notice of change. If it's not listed in that annual notice of change, it means it's not changing. So that annual notice of change will give you a summary up front that tells you basic things that you're most concerned about, like is your premium the same? Is your maximum medical out of pocket the same? Does your drug portion of the plan have a deductible? Are there changes there? What's the inpatient hospital copays? What's your doctor's copays? Those are the things that you are most concerned about, but it also goes into detail about those things that you may not think about because it's not something that you would do every month or every other month, like radiological services that are delivered to you. Annual notice of change is where you start to find out about what's coming up for the next year. But what the annual notice of change tells you is what your current plan will look like for the next year. It won't give you the information about any other plans. So as you go through that first, if you're fine, then don't do anything at all and your plan will just roll over and renew. But if you see something in there that stands out, let's say specialist copay, and the specialist copay is increasing by $20, and you know that you have 4 different specialists that you see, and you see them regularly, so you're using a specialist maybe every month or maybe twice a month sometimes, you're seeing different specialists, a $20 increase could add up to quite a bit of cost. So you need to see if there's a plan out there that has a copay for specialists that's lower. Or if you can get a plan that gives you a give back in your Social Security, which is cash every month, so that you can use that to pay for the increase in specialist copays. There may be options where you can save money, and saving money is what you really want to do. Everything in this world today is increasing in price. Gas for your automobile, your utilities, food, clothing, everything. So obviously benefits are increasing as well. The cost of benefits is increasing. You want to know where you might be able to save money. How can I help you to do that? I can help you to figure out which plans are available in your area. You can set a 15-minute interview at calendly.com/F-Horton/15-minute-interview. So let's talk about some of the changes for 2026. If you haven't seen this presentation before, and I've been doing this webinar every Tuesday morning during AEP, these are some of the changes that are going to come about. Some will be fine. You will be fine with them. Some of them will disrupt your life. So the annual maximum for covered prescription drugs is increasing from $2,000 in 2025 to $2,100 in 2026. Benefits for the Flex card and the food card, that's a huge change for people who have Medicare and Medicaid. The actual program where you were getting the food cards and the Flex benefits has changed. You're not able to have those cards any longer through the program that's offered in 2025. Now, there are other options, but you have to meet certain criteria to actually qualify for those options. What I don't want you to face is come January, come February, and you go to use your card for food, or you want to pay your utilities bill and they say you don't have any money. I don't want you to be surprised. I want you to know what this change means to you. This will affect a lot of people in 2026. Another one is the Part B premium. And when this slide was done, it was told that it would be $206.50. The final came out last week, and the final Medicare Part B premium for 2026 is $202.90. That's the floor. That's the base for Part B premium. So it's going from $185 per month to $202.90, $202.90. Social Security has says that you're going to get a 2.8% increase in cost of living, and you'll probably get a letter about that. So it will show the adjustment for the cost of living, but it will also show the increased amount for Part B premium. Now, for those of you who are paying Part B premium, you could be paying the $202.90, or you might be paying more based on your income. There are formulary changes. Some prescriptions that are now Tier 2 will be changed to Tier 3. And that could have an impact, a bigger impact on your pocketbook, because tier 3 drugs in your plan may have a deductible. And if it has a deductible, that means you pay whatever the deductible amount is first. And after you satisfy the deductible, then you will pay the copay or the co-insurance within the plan. So formulary changes could have an impact on your plan. Network changes. This is the strangest year in terms of network changes. Generally around September, before October 1st starts, we know which providers are going to be in network with what plans. As late as yesterday, which was November 24th, I received a shock that a provider with whom I spoke with on Friday, and yesterday was Monday, I enrolled people last week with this provider, spoke to them on Friday, went into their office on Monday, and learned they're no longer there. And the practice doesn't know if the office will be closed. Right now, they're just trying to get through the patients that are already scheduled. So these are the kinds of network changes that are coming back about even late into the annual enrollment period. We received notices that there are certain providers' offices that are not taking certain plans after we've already enrolled people in those plans for January. So you may get a new card. It may not be the doctor that it says, but then you got a choice. You got to make a change if you want to. It's entirely up to you. There are plans that are exiting. So if you've not opened all that mail that you've gotten, now is the time to do it before it is too late to find out that January 1, you only have original Medicare. And the reason you only have original Medicare is because the Medicare Advantage plan you had is no longer in place. And those notices have gone out. You've been told already that you cannot have this plan because it just doesn't exist anymore. And that's happened throughout the country. But call a Medicare insurance professional. Call me to find out, is your plan still here? And is it still good? I'm going back to the flex card and the food card because I also want to let you know that not only are there some options available so that you can still get those food cards, but the amount that you're going to receive, depending on what plan you're looking at, could be less than what you're getting this year. So that could also be a change for you. The other thing that I wanted to mention, and this is a point about prescription drugs, for those people who have Medicare and Medicaid, this year, 2025, all of your covered prescriptions are zero. That is not the case for 2026. For 2026, you may still have prescriptions that are zero, but it will depend on the tier that your prescription, if it's a preferred generic in most plans, it probably is still zero. It will also depend on where you get the prescription. So getting them from the preferred pharmacy or the mail order pharmacy for your carrier, it could still be zero. Or it could depend on that drug has been changed from a tier 1 to a tier 2. So you do have a small copay. And if you have low income subsidy, which is extra help with prescriptions, that will actually govern the amount that you will pay for a copay if there is a copay that will be applied. But not all covered prescription drugs are zero for the dual plans, Medicare and Medicaid, for 2026. Now, Are you affected by any of these changes? Do any of these things sound like they may affect you? You have the maximum covered prescription drug cost that you will pay, $2,100. The Part B premium, floor amount, $202.90. Formulary changes that could affect you depending on what prescriptions you're taking. Network changes could affect you if your doctor is in network or not in network. Plan exits or the benefit changes with the flex card and the food card. Now, some of these things you can control, and some of them, just face it, you can't do anything about it. You have no control over the annual maximum that you're going to pay for prescription drugs. It's already said it's the same in all plans, all cases. You have no control over the Part B premium. $200 and $290 is the floor. Whatever your income is determines what that's going to be. You could pay none of that, or you could pay an amount greater than that. Plan exits, you have no control over that. If your plan's gone for the year, it's gone. And you actually do not have to make a change by December 7th, but you have only until December 31st to actually get a plan in place for January 1. Otherwise, on January 1, you are going to be with original Medicare A and B only. No prescriptions. Important. If your plan is exiting, you don't have to make a decision by December 7th, but I would suggest strongly you do not wait until December 31st. If you don't do anything by December 31st and your plan goes away January, you have only original Part A, original Part B. No prescriptions. For network changes, you can do something about that. If your doctor isn't in network or not taking your plan, you can change the doctor or you can change the plan. For formulary changes, you can't do anything about that. For benefits with the Flex card, your best route there is to learn what those changes are and how they may affect you. So some of these things, you have the control. You're sitting at the driver's seat and you need to know how these changes will affect you. I have some answers. I have an answer for you if you want to know the answer. You can reach me at 407-340-6282 or set that 15-minute appointment and we can start the conversation. So the Center for Medicare and Medicaid Services, CMS, requires that I have your written permission to talk to you about benefits. So to talk to you about specific benefits, yes, we can have a chat. I can do a needs analysis in less than 8 minutes. But for us to get down to the specifics of which plan actually will work for you, I need your written permission. So that's when you set that call with me. Call me at 407-340-6282. We can get all of that taken care of and we can go from there. Your next steps are to give me permission to contact you, set a date and time that's best for our call, put my number in your phone so that if there's any confusion, let me help you with getting that done. I'm Faye, and I'm with FS Horton Insurance Professionals, LLC. Our office is at 199 Avenue B, Northwest Winter Haven, Suite 240D. And again, the telephone number is 407-340-6282. I want to thank you so much for watching with me today. Thank you so much for taking care of your health insurance by December 7th, which is the end of annual enrollment, or if your plan is exiting, please don't wait until New Year's Eve, December 31st, to take care of that. Thank you so much for being with me today.